All right, good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. I'm going to do a somewhat of abbreviated meeting this morning because I have to jump into another 3-hour meeting this morning. So I'll be trying to be brief and try and give you the latest update as best I can. So right now, as of this morning, there are 97 cases that have occurred in Foxboro since the beginning of March 15th. We have 71 recovered. We have 18 people who are currently currently active and positive in the community, which is actually down by 1 from yesterday. We have 7 people that have been lost during the follow-up phase, and 570 people have tested negative in terms of COVID-19 cases here in Foxboro. So down 1 case that's since yesterday. 3 people have continued to be hospitalized, and we've had 1 death. So those numbers have not changed at all. Overall, in Massachusetts, there are 80,497 cases as of yesterday at 4 o'clock. 410,032 people have been tested, and across the Commonwealth, we've had in Norfolk County, we have 7,129 cases. 676 people have died as a result of COVID-19. And it looks as though our daily cases continue to drop off, the spike being about a month ago, and we've tailed off rather significantly in the past few days. So it's good to see that, and staying pretty good, staying pretty steady at this point in terms of numbers. So let's take a look at what's happening on the report. On Wednesday, the Department of Public Health issued an updated guidance about the appropriate use of laboratory testing for COVID-19 and expanded testing recommendations in clinical and commercial laboratories. The new guidance expands the criteria for COVID-19 testing eligibility. Updated guidelines include all symptomatic individuals, including those with mild symptoms, should be tested. Symptoms of COVID-19 include fever, chills, and shaking chills. Excuse me. Fever, chills, or shaking chills, signs of a lower respiratory illness, fatigue, sore throat, headache, body aches, or new loss of sense of taste or smell. Other less common symptoms can include gastrointestinal symptoms and inflammatory conditions. In elderly, chronically ill, or debilitated individuals, symptoms of COVID-19 may be subtle, including alterations in mental status or in blood glucose control. All individuals who are identified as close contacts of a COVID-19 confirmed case by local boards of health, DPH, the Community Tracing Collaborative, or healthcare providers should be tested. On Tuesday, the Baker Polito administration filed a supplemental budget bill for fiscal year 2020, which authorizes $1 billion in spending necessary to cover incurred and expected costs during the COVID-19 public health crisis. It is expected that this spending will result in no net costs to the Commonwealth after anticipated federal reimbursement and other federal funding sources. Expenses include the purchase of personal protective equipment, rate adjustments for providers of congregate care and other essential human services, incentive pay for state employees on the front lines at certain facilities, costs of temporary field hospitals and shelters, National Guard pay, the statewide contact tracing program, emergency child care for essential workers, and increased costs of local housing authorities and of the shelter system. The authorization will enable the Commonwealth to leverage federal financial support, most notably aid from the Federal Emergency Management Agency, which can only reimburse state spending resulting from eligible disaster response activities. COVID-19 costs not supported by FEMA reimbursement will be matched to other available federal revenue sources. And on the May 13th coronavirus update from the MRC, there are 80,497 confirmed positive cases of COVID-19 in Commonwealth, with 1,165 new cases and 174 deaths as of 4 o'clock yesterday afternoon. Overall, about 410,000 tests have been conducted by public and private sources. 14% of the 8,536 tests reported today were positive. Excuse me. 3,101 individuals are hospitalized with COVID-19 statewide. That's a decrease of 26 from yesterday. The Department of Public Health has regularly released daily and reporting on dashboard information. Healthcare, the hospital capacity as of May 13th, 53% of the Commonwealth's 17,700 permanent and temporary hospital beds are available for new patients if needed. Personal protective equipment continues to be distributed. It's important to note that some of the temporary facilities are starting to be deactivated and decommissioned. It's good to see that process is actually underway at this time. The National Guard has conducted 649 visits and conducted 39,479 tests as of May 13th. Temporary field hospitals continue to operate for the time being, particularly Boston Hope Facility at the Boston Convention Center and the DCU Center operated at UMass Memorial. The Boston facility alone has treated 688 COVID patients since opening, but some of the smaller facilities are starting to deactivate at this point. That's why you're seeing a drop off in the number of beds that at one point we were up at 18,300 beds, now down to 17,700. The Massachusetts Nonprofit Network is holding a free webinar on impacts of COVID-19 pandemic on nonprofit organizations in the communities that they serve as of 2 p.m. on Tuesday, May 19th. As a reminder, anyone wishing to submit comments to the Reopening Advisory Board can do so online. And that committee is meeting again this afternoon. They're looking to issue their report later on Monday. Everybody's waiting for guidance, including us, to try and finalize their report. We're looking to put together our draft report by the end of this week. Today, the House of Representatives enacted to facilitate the delay of the income tax filing deadline in its second remote formal session, which would authorize the state treasurer to engage in emergency short-term borrowing to ensure that tax revenues impacted by COVID-19 do not impact the administration of the FY20 budget. Senate will now enact the bill and send it to the governor for his signature. Federal House introduced a new coronavirus response package called the HEROES Act, which provides $3 trillion in funding for programs, including frontline responder hazard pay, extensions of stimulus checks and unemployment benefits, and expanded testing and conducting tracing funding. Now, that bill is it was submitted primarily by the Democrats. It has not been debated in Congress. Early indications are that it's probably dead on arrival because it goes too far in terms of what it's going to try and do. The Senate is in early talks now to try and see what they can come up with a matching type bill. Of course, the House is controlled by the Democrats, the Senate's controlled by the Republicans. So obviously that's where the point of difference will occur between those two houses to figure out something that will come in somewhere in between to figure this thing out. Resources for residents experiencing job loss or income. You can all go to all of the to go to the www.mass.gov ORGS Department of Unemployment Assistance for all the assistance you can look up and see what's applicable to your situation, and that includes things such as the Pandemic Unemployment Assistance, CARES Act, unemployment changes, and unemployment town halls. Department of Transitional Assistance is offering some guidance. They're at mass.gov DTA COVID-19 resources and transport. Pandemic EBT benefits for school children is also a good resource for information on that issue. And how can you help? Blood donations are important. We need to get those those supplies up. Obviously, there's been a lot of cancellations of blood drives, so this is a really critical time for people to donate. And it's important to stay home and also to continue to wear your face mask in public when you're around other people. That's obviously the guidance that continues to be employed statewide. And I was listening to some of the national discussion about this very topic this morning, that even if kids go back to school in the fall, that it may be requirement that everybody wears a face mask, even kids. Of course, not below the age of 2, of course, but kids going into all levels of school will be wearing a face mask. That's one point of discussion that's being looked at right now, so that school can actually occur at some time in the fall. So there is quite a bit of discussion about whether or not that's going to happen at all at this point. So continue to stay tuned. We'll continue to keep you updated on what's happening. Also locally in Foxboro last night, the selectmen, the school committee, and the advisory committee all met together and all agreed on the approach to how we're going to handle the next year's budget. There was unanimous support on all three committees on how to approach it. It was good to see that, so that we can actually go to town meeting with a unified position. So that will be the plan. The plan for the next town meeting is expected to be on June 15th. It's going to be held at the high school. The location has been resolved. We're not going to work out the details of how that's going to work, and we'll continue to keep you updated on what's happening on that front. The election is on June 8th. At this point, absentee ballots are available now. If anybody wants one, you can go online and check that out and get the information and submit the request for an absentee ballot. You can vote in that form, and that's actually encouraged given the circumstances under which we're operating. We'll continue to keep you posted on what's happening and when we plan to get the doors back open for all of our operations. We're working on a plan that keeps everybody safe, you as the public, and as well as our employees, so we can all continue to get the services that you need, but also do so in a safe and protective way for everyone. So that's all I'm going to provide for you this morning. That's all I can provide at this point. If you have any information that you want me to share, you can send something to me at at wkeegan@foxboroma.gov, and I'll be happy to put something out for you. Until then, I will see you next time. See you next time tomorrow morning in and around 10 o'clock, and with your latest COVID-19 update. Thank you very much.